give your full name, please?
Tony O'Sullivan.
And what is your clinical job?
I'm a consultant community paediatrician, mainly working in the arena of childhood disability.
And yes, so could you explain that? What does that involve? What does that entail?
We work in our community child development service based at Kaleidoscope Children's Centre up the road from here. For the last 3 years we've been united with the hospital, providing integrated care for children across the hospital and the community. Kaleidoscope offers a whole range of services for children with disability, including motor disability, cerebral palsy, autism and learning disability, sensory impairment, and also services for children who need safeguarding, children in the care system, place of adoption, and we work with the range of therapists, nurses, and we also co-located with social care, disability social work team, education and mental health service in what is actually unique in England.
And what is your other role?
That's my day job.
Yeah.
My other role is Director of Children's Services across the hospital and community for the last 2.5 years.
So for the purposes of this People's Commission, what is your expertise?
My expertise comes from working in Lewisham for 20 years and having been part of building up the networks of care for children, often very vulnerable children, in a way that was actually in advance of government policy. Government policy was escalated after the Victoria Clamby death and the enquiry, but we'd already started building networks across health agencies and across local authority agencies and indeed the voluntary sector to build that very necessary set of supportive environments for different groups of children, and doing that also with the hospital. We hear a lot about community-based care, which is a sort of kick in the face to hospitals, but Lewisham, to me, Lewisham Hospital is part of community-based care. It's certainly at the centre of our community, and as Anisha just said, it underpins safe community-based care.
I want to go back in time. What is your first experience with the NHS?
Well, that would be as a child. So my father worked in the NHS. He's Irish. Well, he was Irish. He's no longer with us. And he came to work in England before the war as a hospital consultant, school doctor in training, and then he was in the war for 6 years, which he regarded as something that, although he's Irish, was a democratic issue against fascism. And then when he came out of the army, the NHS was fantastically formed, and he was a GP in Manchester for the rest of his professional career. And my first experiences that I vividly remember, he would be the GP in Manchester. He had a list of vulnerable patients, and just one example, he would give, we would have our Christmas dinner ready, and we would go out to one of the very elderly Bedouin women in Gordon and give her the Christmas dinner before we started at home. And I thought that was pretty good. That was part of the NHS. It was one meal at least, better than meals on wheels.
And what is your commitment to the NHS?
My commitment is total to it because I think it's the most democratic achievement that we have in this country. It's the greatest contribution to health equality that we have, and although people talk about it as being free, it's not free. It's paid democratically out of taxation, and it's free at the point of need. So those who don't have money, either at the time or at all, get exactly the same care, and I think that's the right thing to do. Well, I did thoroughly enjoy hospital training, newborn babies and general paediatrics, but I thought that the expertise that was generally centred around hospital in terms of specialism, but only GPs, then it's a different specialty in its own right, but that expertise should be brought into the community. And so, along with others where community paediatrics was a developing specialty, I thought we should be continuing to work with hospital, but build up a network of services that would actually facilitate children, for example, with disability, achieving in their homes, their nurseries, their schools, and bringing specialist therapy, specialist nursing skills, specialist paediatrician skills out into the community, and therefore working with GPs, with schools, and the hospital as well.
I want to ask you now about the TSA proposals. What are your main concerns about the proposal?
The main concern about services, as opposed to objections morally about what they've done, is that for 15 to 20 years we've been building up a set of networks in children's, and you've also already heard also in care of the elderly and mental health and all these other areas. And we've been doing it partly because we knew we should, and then later on because it's part of government policy. And then that is going to be destroyed because a major hospital is going to be taken out of the equation, and we will be relating one set of hospital and care service to a different set of social services, different set of mental health services from 3 or 4 different boroughs, and it will just return to the chaos that we had 20 years ago. So we'll be starting all over, and the colleagues, if they are colleagues, that we talked to in the TSA process actually know they've done that.
So what does this mean for children in Lewisham?
Well, it means that children in Lewisham and in Greenwich, I should say, are 2 of the most deprived boroughs in London, and they're in the top most deprived 8% of local authorities throughout England, so the top 8% out of 325 local authorities. And that's not a statistic alone, it's vulnerability. Lots of issues around elite, one of the youngest populations, one of the most vulnerable populations, one of the highest populations of young children with sickle cell disease, for example. Lots and lots of risk factors that exist with deprivation are visited in Lewisham. Lewisham and Greenwich have the 2 highest numbers of very, very critically ill children that have to be retrieved from the hospital and taken to a paediatric intensive care unit in the whole of the South East sector. So I'm starting from the fact that we have vulnerable, ill children in a deprived population. They're taking out of the hospital, they're reducing access to a deprived population, all of the things we've heard, and it will lead to worse care. Absolutely lead to worse care.
So what provisions have you made by the Secretary of State to deal with that, to plan for those children?
Well, he's not told the truth, but he's basically made a statement that the aftermath of his decision must be taken. What's the word? Somebody must have regard to it in the ensuing period, and that's not the way you plan for serious service planning changes. So he's given us a decision and sort of said, sort it out.
So there is no plan?
There is no plan. Sir Bruce here has eloquently said that children's services are all well provided for by Matthew Kershaw, and they weren't provided for in any shape or form. There was no analysis of need, there was no description of current service, there was no proposals for this or that proposal, there was no risk assessment. You can't risk assess a proposal that you haven't made, and children were assumed as, the term I use, as collateral damage of the major decision to close the hospital.
So what was the consultation about children and their needs?
I'm sorry, say that again?
Consultation. What was the consultation on the part of the Secretary of State in respect of children?
Including the TSA process?
Yes.
The consultation from Matthew Kershaw and the Special Administration process was virtually zero. They set off last July with a structure of having forums for hospital-based care and community-based care. And I was unfortunate enough to go to 4 of these. And in the first one I went to, there was an analysis of the community's needs in terms of mortality, hospital attendance, numbers of procedures and so on. And there wasn't a single piece of data about children. So they've been forgotten. So we raised this vigorously and said, I think you've forgotten 20% of the community.
Can I if you could hold your thought, how many children are we talking about?
In Lewisham there are 63,000 children under 19. And across the 6 boroughs, over 300,000. In Greenwich it's approximately the same, so about 120,000 for Lewisham and Greenwich.
So sorry to go back to the hospital care, you said there were 300,000 children.
Sorry, I lost my thread, I'm sorry.
And the consultation, what was said there?
So, thank you, sorry. So, they huddled together and then they said that they would arrange a meeting. So they arranged a consultation meeting at the last minute, and it was maternity, which they also seem to have forgotten, was thrown together into one meeting, hastily convened along children as well. And as in the other meetings that you've heard about, we weren't discussing any details about actual children's needs. It was led by the consultants, McKinsey's, who got £5 million for it, and they were telling us to do blue sky thinking at a time when the storm clouds were gathering across South London. The only blue sky was McKinsey Consultancy's fees, I think. And so so we were unable to get into the actual detail, which is absolutely necessary. We're talking about a wide range of diseases and conditions that children have. Children are often regarded as a disease. You have diabetes work groups and oncology work groups, and then you have a children's work group as though they're a disease, but they're precious and they're complicated, and there was no planning at all done for it. And when that was raised with the TSA team, they were actually shamefaced about it.
So what was the data that was used?
Well, there isn't any data about children in the report. The only data is the births and the numbers of children that exist. And they have the birth rate wrong as well. I was at the same meeting with Jessica on maternity, and we challenged the birth figures they have because they were modelling it in such a way as to justify closing down Lewisham maternity. And there were at least 2,000 or 3,000 births out of the sector because they were over 2 years behind in their data. We said, your data's wrong. And I said, this isn't, you can't discuss the data, that's been agreed. This was a risk analysis work group. So I said, do you think it's a risk that the data's wrong? And they said, we're not discussing data. And then they finally agreed to put it down on the risk register that their data may be wrong. And they subsequently changed the data because they were wrong.
So to what extent has there been any professional analysis?
Of children's needs zero. I would absolutely say zero. And senior people in their process confessed to that.
That's my last question to you. Concerns your experience of those key players and what they have said to you.
Well, stop me if I'm going on too long, but the first episode was one of the public consultation meetings, and I raised the question of the health equality impact assessment not having been completed. And that's an essential requirement of major change, analysing proposals and risks. And Matthew Kershaw at the end of that meeting came up to me and said he apologised that the health equality impact assessment hadn't been done, but there was no time because of the time scale of the TSA process, which he suggested was being used in the first place last April. The second example was Matthew Kershaw, he's the TSA, sorry, not to be personal, TSA, the medical director of the London NHS, and the medical director of the sector, the 6 boroughs, came to a meeting of consultants at Lewisham Hospital. And the medical director of the NHS in London is actually a paediatrician, so the colleagues in the audience gave him quite a hard time. How could he forget children when he's a paediatrician? And at the end of the meeting, we had a conversation with a couple of those people present, and they actually said the TSA process should not have been used in the circumstances that they were facing. It was unjust for Lewisham. They recognised that networks would be shattered to children, but it was too late. And pardon the expression, they said Lewisham Hospital was being shafted.
Thank you.